Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And today is day one from National Public Health Week. And I wanted to go over what today's theme has been. Let me go ahead and get started. The theme, by the way, is community, and I'm going to explain to you what that means in a moment. So community includes 4 segments. One is for science, the second one is for action, the third one is for health, and then fourth is in celebration. And what I'm going to do is go over each one of these in order to better explain what they mean. So the first 2 that I said were for science and for action. For science, community is where we are. It's our connections with others who share similar interests, attitudes, and goals. Over the past few years, those connections have been greatly impacted, with COVID and social distancing. Some of these communities has not maintained as much social cohesion as they should. And I have actually written and collaborated in research articles regarding this loneliness. The other portion is for action. Become more engaged or re-engage with your community and make an impact on public health. For instance, helping out in a community garden, maybe volunteering in food banks, food pantries, local food distributions. All of these are considered for science and for action. Now, what's community for health? Well, this has an interesting study. People with greater feelings of support, connection, and inclusion within their networks may actually live longer. The reason being they respond better to stress, have stronger immune systems than those who are isolated from their communities. So this shows that community plays a major role in terms of affecting overall health. And the final is research also shows that cross-sector efforts are needed to redesign the conditions of our social, built, and natural environments to promote health equity and improve social determinants of health. What that means is that community doesn't just mean cohesion versus isolation. There's much more cross-sectoral improvements that need to be done and considerations that need to be done. For instance, in just built environment, one out of the 3 is very important and leads to a better structure within a community. The final is in celebration. You might be thinking to yourself, how can celebration lead to community? Actually, it does. The White Earth Nation I'm going to be showing you in the next slide incorporated cultural heritage and spiritual values while focusing on a vaccination campaign. Also participation in traditional Greek dances or whirling dervishes. All of these improve physical fitness and well-being of elderly adults. So this is an Anishinaabe medicine wheel. This is interesting because you usually start here and then go go clockwise. And yellow is usually east, red is usually south, black is usually west, and white is usually north. And this is the traditional medicine wheel. And this was converted into certain types of strategies that were used in order to connect with the White Earth community. Being ready, develop a plan to protect your family by learning about COVID-19. See White Earth Nation social media, public health, infection prevention guidance. Get set. Prepare your family and home ahead of time for the onset of COVID-19 emergency by acquiring PPE, protective equipment, and sanitizers. Stock a 6-week supply of non-perishable food items. Go. With your stay-home plan, take the necessary steps to work from home, restrict travel to essential needs while wearing a mask and practicing social distancing. Monitor the health of your family and seek medical attention if necessary. And then the last is the North. Stay in touch with White Earth Nation. County and state online safety guidance with your loved ones by phone or email, with your medical provider, and with your traditional healer, which is interesting because the traditional healer plays a major role in Anishinaabe medicine wheel. So this has given you a wonderful overview of not only this week about building community, but also how this plays out within the public health domain. Thank you for listening.